Hello, good morning, good afternoon, good evening everyone. Welcome po saan man panig ng daigdig kayo naroon sa ating 90th episode and the beginning of Season 8 of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us for today, welcome po at sana po magustuhan po ninyo ang ating topic for today and our future topics na patutunguhan po at least for Season 8. For today's webinar, we will be tackling about repeat COVID-19 infections po or reinfections with SARS-CoV-2, which refers to a person being infected, recovered, then reinfected again. So recovery from COVID-19 and vaccination po, maiisip po ninyo, no? They do not seem to prevent reinfection, particularly among our frontline healthcare workers na lagi pong exposed lalo po sa mga may COVID-19. On the other hand, meron din po tayo nung tinatawag po natin na long COVID, which is a topic that we have discussed at least twice in our previous webinars. These are post-COVID conditions po that may be continuing, ongoing, recurring, returning, or even new symptoms after one has recovered from an infection. So marami po sa atin na nagtatanong, ano po ba ang mga sintomas ng long COVID? Sino po ba ang may mas mataas na risk ng pagkakaroon po ng repeat version po ng pagka-COVID? Ano po at alin sa mga variants po natin ang nagkukos po ng greater risk for reinfection? So if you want the answers from the most credible experts po for today, please stay tuned for our webinar entitled COVID-19 na naman. Repeat COVID-19 and long-term effects. Be sure po to tune in, lalo na po sa ating mga nanonood sa YouTube at sa ating Facebook. Sana rin po ay makasali rin po kayo sa ating webinar for today. Dito po sa Zoom, please share our webinar details to your family, colleagues po, your network, mga katrabaho po, to be able to get the latest science-based and evidence-based information. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. Medyo marami-rami po ang nasa webinar pong ito for today ng ganito po kaaga, which is a good sign of our topic for today and our expert panel po. Always look forward to Fridays because I get to share hosting duties with my partner and beloved mentor po, our adjunct research faculty at the National Telehealth Center. Also, a special envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Hi, Raymond. Good afternoon. Magandang hapon po sa inyong lahat, wherever you are. Great to see our usual audience here. Natutuwa kapag nakikita ko yung mga pangalan nyo sa chat. So, mabuti nandito kayo. And in fact, I was gonna ask, parang meron tayong konting exercise ngayon, Raymond. Kung sino sa inyo nagkaroon na ng repeat COVID, ilagay nyo nga sa chat yan. If you have had COVID more than once, we just want to get a sense of that. But that's our topic, and we know that our frontliners are very concerned about this. And we have excellent speakers as always. Nagpapasalamat tayo sa mga speakers natin na napaunlakan tayo ulit. And so we will talk about reinfections and we will talk about long COVID or post-COVID. Okay, so over to you, Raymond.
Thank you, Dr. Susie. So, ito pong topic pong ito, lalo na po sa mga medyo bago-bago po sa ating webinar. We usually start off our webinars po with what we call the person on the street interview video conducted po by our team over TVUP. Para po sa ating person on the street video or POTS video for today, ang tanong po that na itanong po namin sa ating mga interviewees, sa palagay niyo po ba na maaari magkaroon ng COVID-19 ng paulit-ulit? At sa tingin po ba ninyo, ano ang mga pwedeng gawin para hindi pa ulit-ulit na magkaroon ng COVID-19? Please watch this.
Pwede po siyang ma-infect ulit. Yung tao pwede pang ma-infect ng paulit-ulit kasi meron naman po mga cases na ganun na kahit bakunado na rin po, na i-infect pa din sila.
Pwedeng magkaroon ng COVID-19 ng paulit-ulit ang isang individual.
Meron po akong kilala na nagkaroon po ulit siya ng COVID, na infect po ulit siya twice po. No? Working din po kasi siya sa hospital, kaya po siguro mas exposed po siya.
Meron akong kilala na nagkaroon siya, nag-test siya ng positive. Then, after a month or two, nag-test ulit siya ng positive.
Nagka-COVID kami actually twice na. Nung una, yun talaga yung medyo severe kasi ako tsaka yung partner ko.
Kung ano po yung ginawa before, tas kung saan ka na-infect, siguro dapat po iwasan na po yun para hindi na maulit. At saka makinig din po sa mga experts kung ano po yung payo po nila.
Pagiging mas accessible po ng ating mga healthcare system dito sa ating bansa, lalo na sa ating mga mahihirap na mga kababayan.
We're going there na matatapos din yung COVID. It's just that, pero hindi siya mawawala. Pero kaya na natin siya i-control. Kailangan mas mapalakas pa rin at mapabilis yung pagpapabakuna doon sa ating eligible population. Especially yung mga nasa priority group, nasa high risk.
Sinikap namin na magpa-vaccine, makumpleto agad yung vaccine namin. Gumaling na kami after 1 month ata. Talagang kinumpleto na namin yung vaccine. Tapos, nagka-booster na rin kami. Unang party na pinuntahan namin, ending after that party, nag-positive. Tapos yung partner ko asthmatic siya, kaya medyo kinabahan kami kasi nag-40 yung temperature namin parehas.
Sa mga public and private hospitals na rin po, na siguro po skeletal workforce para hindi po paulit-ulit yung taong na-i-infect din po. Pero ngayon po nag-alert level 1. So, unti-unti na rin naman po lumuluwag yung restriction. So, hopefully po, by this year, kahit hindi po talaga siya matapos na, pero sana po, mabawasan na po lalo yung mga active cases.
Okay, thank you very much, TVUP. It's always good to hear from ordinary people what they think of this, and it looks like a lot of people have had repeat infection or reinfection, and I'm looking at the chat, marami rin sa inyo ang mga nagkaroon ng reinfection. No? So alamin natin, we'll know more about this, and we will of course be talking to some experts who can give us more information about reinfection and long COVID. So before we proceed, I just have an announcement. Sabi nga ni Raymond, 90. It's the 90th webinar, my goodness. Okay. And it means we're preparing for our second year anniversary. And for our second year anniversary, we just wanted to remind everyone, as we did last year, we have a COVID-19 Heroes Memorial. And that is to honor our global Filipino medical frontliners who have succumbed to COVID-19. We continue to collect photos that will be included in the COVID-19 Heroes Memorial digital album in the Stop COVID Deaths Facebook page and the special AVP. So we're preparing another audiovisual presentation. And so if you have a Filipino medical frontliner family member or a friend or a colleague in the Philippines or even in other countries, please send us a high-resolution portrait photo of at least 300 DPI with their name, date of birth, date of death, and their occupation. Please send that to television UP and web, TVUP, television@up.edu.ph before April 9. And parang it's a good thing. We're slowly opening up. We're moving. I think we're seeing the light at the end of the tunnel, but there were those who sacrificed their lives, and we don't want to forget that. We want to honor them, and we want to remember. So please help us by sending us photographs and names of people you know who were frontliners. Thank you very much. Raymond, over to you.
Thank you, Dr. Susie. So, ulitin lang po namin, the Filipino medical frontliners have been recognized as one of the best, if not the best in the world. We want to be able to immortalize po ang kanilang sacrifices and their selfless contributions dito po sa laban against COVID-19. Before we proceed, just to let you know, our webinar po can accommodate a maximum of 3,000 participants. Meron na po tayong a little over 900 attendees here sa Zoom. I'm sure meron pa rin po sa mga YouTube at Facebook po natin. So please join us kung makaka-join po kayo sa Zoom so you can fully experience the interactive program. Pero hindi naman po ibig sabihin makakalimutan po namin kayo na sa mga nasa YouTube or nasa Facebook. Lagi po kami nakaabang lalo po sa comment section. Kung meron po kayong mga any comments or katanungan po, that will be very, very interesting to be posed to our panel of experts. For those who are asking, certificates of attendance will be given to those who have watched at least 50% of the webinar duration po. Ito po ang itsura ng e-certificate. We have already distributed completely for all 88 webinars po, no? Up to webinar 88, medyo may mga pahabol pa po kami for webinar number 89 with regards to the certificates po. Please let us know if you have any trouble receiving them, or if you feel you should have received them but did not receive them, please let us know. And finally, before we introduce our opening remarks speaker, we would want to show onto the screen, especially for those who are nandito po 938 and counting sa 939 sa ating Zoom. If you open your browsers, especially for those on YouTube and Facebook, go to www.menti.com and type in the code 2934-1486. That's 2934-1486 for you to be able to join in our fun quiz, which will also serve as your pre-test for our webinar. For today's webinar, we will be still utilizing our standard panel discussion format. Speakers will present their slides. We have a reactor who also will be weighing in, followed by Q&A session entertaining all the questions we will be receiving sa lahat po ng kung saan man po kami na live stream. If your question po is selected po and you will be asked to open up your video po, sana po paunlakan nyo po kami na makasama po sa ating panel to be able to ask your question live to any one of our panelists. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. I know you're all excited to get started. And for our introductory remarks, we have somebody who you all love. You always like him when he's on the webinar. And I think our country has just been very fortunate at this time. And I'm sure when he looks back over the past 2 years, he will have a lot to write about what happened to his life. We have the director of the Philippine General Hospital, Dr. Gerardo Legaspi. Gap, welcome to the webinar. Kamusta ka na?
Welcome,
And congratulations, Sir Gap, sa Lingkod Bayan Award, sir.
Oh, Lingkod Bayan
Maraming
Award.
salamat po. Mas maraming
Oh.
deserving doon, pero maraming salamat. At I'd like to congratulate you first for this 90th edition. Going to the 8th season, marami na kayong teleserye natalo dahil 8 seasons ng Stop COVID. But rightfully so, because of all the knowledge and the wisdom that has been imparted, and congratulations on that. And it's my honor to open this very special series now of our Stop COVID, which tackles with the repeated infection. And I think as a frontline, I see a lot of healthcare workers on the chat group. And I think being one of the early ones to have tested positive, let me just take some time to share with you those experiences. You very well know that we prepared 1 whole week to set up PGH as a COVID referral center opening in March 30. We barely had any sleep. We were here for 7 days a week. The tension, the stress, the emotional and the physical tension probably already shut down our immune system. But still, we were following protocols. And in the first week that we opened this COVID referral center, we had to test ourselves. And lo and behold, I got a text from Dr. Celia Carlos that I'm positive. Dati 1 linggo bago lumabas ang resulta, no? So kumakain ako noon sa harap ng aking mga kapamilya dahil nga wala naman ako nararamdaman. Lang kami, routine test after opening. At na siguro ma-imagine nyo anong terror ang napunta sa isip ko na na-expose ko ang aking pamilya sa 1 linggo na yon. No? Katulad ng sinasabi ng protocol noon, I isolated myself for 2 weeks. And thankfully so, I was asymptomatic all the way. But of course, at that time, I think I had 4 doctor friends who have died, and around my age also. And I think the emotional toll was bigger than the physical toll at that time. No? So lahat na nag-positive ng bandang early 2020s, makaka-relate kayo dyan. No? So ang lesson noon ay talagang pwede kang mag-positive at walang simptomas and you'll be carrying it around, lalo na wala pang vaccination noon. Fast forward to 2021 when we thought we've learned a lot about COVID-19 and its transmission and in the whole course of that time before this big surge in July, we were already careful because of the protocols that we've established. And I know probably I have napakababa ang isa sigurong importanteng malaman ng ating mga co-health workers, dapat mababa ang threshold natin sa pagpapatest noong time na yon. Ano? An ordinary sore throat, a body ache was already enough reason for us to test. And thankfully, in the next months that ensued after my initial positive, I was always negative. Until July, when I felt persistent body aches after a weekend of biking, which I thought attributed to the biking. But as I said, dahil nga dapat medyo praning ka pagka ikaw ay nasa hospital at nag-handle ng mga pasyente. Nagpa-test ako ng maaga. And true enough, I tested positive. But I continued to be symptomatic with body aches, fever, and some cough, and sore throat. That was the Delta variant raging at that time. And I think, again, the very high mortality rate sent naman ako bata, ako'y may hypertensive, at ang tulog ko ay kulang ba araw-araw. So kinabahan ako ulit for the second time, and rightfully so. When I had my workup, merong mga ground glass opacity sa aking CT scan ng chest, at ako'y pinauwi ni Dr. Berba, at nag-agree kami na dahil moderate lang yung aking mga findings sa chest CT, sa bahay na lang. So I think ang point doon, yung nahalubiluan mo na nakasama mo ng mga ilang araw, inaalala mo na naman. So ang pamilya ko, inaalala ko, ang mga kasama ko sa trabaho. Thankfully, I think because of the early testing that we do with the slightest symptoms, all 57 of my contacts were negative, including my wife, who I'm with every day, my children as well. So I hope that message is clear. Taking care of others also is a factor in protecting ourselves in the same process. So after that, ako po'y na-isolate ng 10 araw ulit. Dalawang linggo kasi Delta yon. I was Delta number 11 sa gene sequencing. Maraming salamat kay Dr. Eva de la Paz. At nalaman ko ng maaga ako'y Delta. So ang precautions ay lalong tumindi because of the virulence of the virus at that time. But after going through the protocols of monitoring and early intervention in COVID, thankfully I surpassed all of that without any symptoms. But I think alam natin na lumalabas ang mga datos ngayon tungkol sa epekto ng COVID sa utak, sa baga, sa puso, sa mga nerves. At ito'y ating matutunghayan ngayong hapon sa mga eksperto nating mga kasama. At sana'y matututo tayo na kung ito man ay bumalik ulit sa ibang klaseng form in another variant, ma-apply natin lahat ng natutunan natin with repeated infections. But for now, I hope you're gone full circle. At kung kumakonti ang kaso dahil tayo nabakunahan at tayo lalong mas magaling mag-ingat, it's a major achievement for us in the crisis that we have just gone through. So maraming salamat ulit, and I'm excited to listen to our speakers, especially Chancellor Fidel Nemenzo, who is a repeated infection patient. Thank you very much, and good afternoon to everyone.
Okay, thank you very much. It's Dr. Gerardo Legaspi, the Director of the Philippine General Hospital. Gap, ang ganda ng background mo, no? Very historic. I love the Zoom background. It's a painting.
That's the only remaining artifact of PGH after the war, a 1939 painting. Wala na kami
Wow.
ibang nakita.
That's amazing. That's amazing. And again, as I said, you will be one of those who will look back at these 2 years and have so many books to write about what happened. Not just COVID, pero nasunog pa, kung ano-anong nangyari, no? So hopefully, I don't know, hopefully we're seeing the tail end of this already, and we're just so glad that you're all okay. Those who have had COVID, no. So I thought it was really great for you to start that way, kasi marami tayong mga frontliners na talagang nagkaroon ng reinfection, no. So maganda na rin malinawan tayo ngayon ng mga experts natin about this and about COVID. Okay, so Raymond, over to you. I think we're gonna do our fun quiz, or we're gonna do our fun quiz. Yeah.
Yes, Dr. Susie. Thank you. Thank you again to my idol, Director Gap. Maraming salamat, sir. We hope your health continues to improve po, at hindi na po kayo magka-COVID ever, sir. Maraming salamat po. So for our audience po, no, what we usually do is we encourage as early as now for you to be able to put in your questions in the Q&A box, lalo na po sa mga nasa Zoom. We are now numbering almost 1,100 attendees here in the Zoom. So maraming salamat po, and we'll wait for additional numbers from YouTube and Facebook. But for today's pre-test or fun quiz po, no, those in the Zoom, makikita nyo po may lalabas po on your screen na para pong opinion poll po ang nakalabas. Yun po ang ating pre-test quiz for today. It's the same set of questions that we have for our Mentimeter. Again, may mga nakikita po ako nagtatanong ng code sa chat po. Ang code po namin ay, ano nga ba ang code natin? Ang code po natin ay 2934-1486. That's 2934-1836. So, para po makasali po kayo sa Mentimeter. For our first question, when do we consider post-COVID-19? We have 4 options. Option 1, 2 weeks after the acute illness. Option 2, 1 week after the acute illness. Option 3, continuing illness. And option 4, all of the above. Isa lang po ang tamang kasagutan dito po sa opinion poll po natin. Before we proceed, let me take the chance to greet those who are joining us locally po, no? From Nueva Ecija Doctors Hospital in Cabanatuan City in Nueva Ecija, Ormoc Medical City in Ormoc City, Leyte, the City Health Insurance Office in Cagayan de Oro, Galinato Family Clinic and Hospital in Sultan Kudarat, and the one of the bigger hospitals in Cebu, Vicente Soto Memorial Medical Center in Cebu po. Our second question for today is reads, what is the most important precaution that our healthcare workers need to continue to observe? Again, isa lang po ang tamang kasagutan po rito. Number 1, wearing face mask. Number 2, full vaccination and booster. Option 3, physical distancing. Option 4, improved ventilation. And option 5, lahat po na nabanggit or all of the above. We are seeing more than 500 respondents in the Zoom, and more than 170 na respondents po sa Mentimeter. We will not be closing ang ating Zoom poll po at ang ating Mentimeter po as we move on to our webinar proper. Dr. Susie?
Okay, thank you very much, Raymond. And I'm still fascinated by that.
Parang white blood cell.
Nakikita na ako dyan eh. Parang TikTok sa akin yan. It's very, what should I say? It's very satisfying to watch. Okay, so we go to our first speaker for today. And oh gosh, we have really a good panel today. And we're starting off with someone somebody we all respect, leading pulmonologist in the country, internist. And he recently got a special award. So we're going to show that. Okay, so we would like to say congratulations to our first speaker, Dr. Camilo Roa Jr., who is now a new National Academy of Science and Technology academician. Congratulations, sir. Well-deserved, long overdue.
Congratulations, sir.
And welcome to the webinar. So Dr. Roa is a professor of medicine at UPPGH, and yan ang takbuhan natin sa lahat ng mga tanong sa katanungan. Go ahead, Dr. Roa. Go ahead, sir.
Yes, Susie, thank you very much for the invite today. And as you have reminded me, tayo yung nauna sa dito sa webinar. First
Yeah, sir,
ever.
the very
So,
first one, kayo
from
ang,
number
kayo ang
1 to the
speaker.
90. Yeah.
Oh, my goodness. Sige, sir, go ahead.
Yeah, so I will share my screen now. So I'm so happy that with me also as a speaker is Nina Berba, who will talk about the nitty-gritty of the virus. What I would just like to show in my part is the fact that while we may have gotten through this pandemic, maybe we're not that clean yet. So my topic is about the long COVID, the long haulers, which has been mentioned by Raymond to have been discussed actually in this series before. Now, so I have nothing to declare as personal conflict to this topic. And wow, we are now alert level 1. We don't have to limit spaces, restaurants, even the church and so on. What is left is actually for us to just continue our mask and other minimum health standards and continue vaccinating. And that's very important. And I will show you partly the reason why. Now, the reason why we are in alert level 1 is actually we went through this curve of infection, the one on top, okay, the blue, and the last one was fairly, like shocking because the Omicron actually infect the whole family, and we had it so fast.
Okay, I think we lost Dr. Roa. Did we lose Dr. Roa? Sir, nandiyan ba kayo?
Hello, I'm back.
Still here.
Okay,
Okay.
go ahead. Go ahead, sir.
Okay. I'll share again. So, yeah, so yes, and while we had a very high infection rate that came so fast, but it went out also that fast in a month's time, the mortality did not really go up that much, and it continued to go down, and now we really have very few of these cases. Of course, PGH still has a big number because it's a referral center, but in my other private hospitals, we don't even have a single case now in 2 of them. And so is this it? Go na ba tayo? Well, let me just go to this question and mentioned by Susie, kulig mo yata to si Dr. Gupta Smith in WHO before, and she cautioned us that if one is still experiencing some symptoms even after so-called COVID recovery, it may be something like still part of the COVID. They call it the long COVID. So what is it? How do we define it? This is very new, and the definitions can still change. It's still a fluid situation. So persistence of symptoms, having symptoms even after COVID, that is not explained by other conditions, can suggest the presence of this post-COVID-19 syndrome. And there will be other names that I will show you. And this is seen in 10% to 20%, but if you actually look more closely, it's even much higher. And I will show you the statistics. And the manifestations can be varied from something you can see to something you do not see. And the something that you do not see that is very disturbing will be fatigue, breathlessness. I have patients who come to me, I am a pulmonologist, and yet the lungs are clear. Even lung function is acceptable. Not enough for these patients to come to me and complain of breathlessness. The oxygen saturation is good, but they are breathless. And that goes also with cognitive function. They have the so-called brain fog, that they have problems in thinking, being forgetful and slow in reaction, and also some psychological disorders. And I will go to that also later. And these manifestations, partly to answer the questions earlier, actually may have started at the time when there is COVID. But of course, at the time of the acute COVID, people focus on the on the acute inflammatory situation at the time, so the fever and the coughing and so on. But then they notice after recovery, after they are negative already in the testing, that they continue to have some cough, they continue to have some inability to do these things, or as I mentioned, even a problem of breathing. So some persistence, and in other situations, it's relapsing. It gets better, then it gets worse again. Not necessarily due to reinfection, but I'd love to see what Dr. Berba will tell us in a short time. And the recovery can be fast. The trend is towards recovery, but that recovery can be fast or also very slow, more than 6 months sometimes. And note, this is not just a marker of the disease. This persistence of manifestations can actually be very important in a good number of patients. In fact, people have been prevented from going back to work because they could not work, they could not think, and some become depressed, and we have reports of even suicide, successful suicide. Okay, so the group of Lopez Leon published last year a study looking at all the reports about long COVID, or you have the terms here on the left, and the different ways these are actually described. And in her publication, after drilling through the reports and removing those that are not easy to verify or not well done, she came down to a papers of 15, where actually these are studies that cover almost 50,000 subjects. And what did she find out? In this slide, you see that you have here different manifestations related to or attributable to different organs, and some are more common than others, but 80% of those asked actually felt something. So it's quite common, but not very disturbing in most. Okay, the 5 most common manifestations that are significant, okay, include fatigue, then headache. This is the attention disorder. Now the hair loss, now I didn't get COVID, so my hair loss is not due to COVID, but some people do, and the dyspnea I was mentioning to you. Okay, and in this study by Davis and her group, she showed that the trend towards in time, and this is a 7-month study, is actually towards improvement, and long term we expect resolution, although we have known also some people who did not fully recover. Okay, and if you look at this based on the severity reported in the first week up to the month 7, you see here the time trends. Like there are at the end of the acute COVID, when they are declared COVID recovered, there are those with still some really problematic manifestations, but they tend to track down across time. But take a note, some of them actually get worse sometimes along the way. And those who are destined to recover faster are actually recovered early on. I mean, they know that they are getting better. But those who tend to have still continuing symptoms more than 3 months, then they can expect that those symptoms to actually even go even longer than probably 6 months. Okay, so what's causing this all? Now, we know that COVID infection really ravages the organs, the cells, where they are located. So, and the COVID virus is trophic to the ACE2 receptors, plus another receptor beside it. And it usually affects the lung, the respiratory system, the upper respiratory system, and then the lung. Well, fortunately, the Omicron is not so trophic to the lung itself. So that's why we didn't get that much mortalities and severe illnesses in Omicron. But Delta is. So, well, fortunately, I just saw the latest statistics. Most of the countries where Omicron is now ongoing as the dominant variant, there is no more Delta left. So they take over the colony, so to speak. But of course, we are not sure if there's a future virus that will come that will be more Delta-like. Okay, so anyway, so this is how it goes. The infected areas gets affected by the virus, and then there's an immune activation, and in fact, the hyperimmune response can actually add to the damage, and you get into problems like in the lungs, you have respiratory failure, shock, and even death. But if you are able to control the immune response, modulate it via natural means, sometimes the body just does it. Okay, or you are able to give treatment that reduces the immunologic response, the hyperimmune situation, like corticosteroids and even tocilizumab and other anti-inflammatories. You can get into the phase of recovery. Okay, so this is recovery. But then some people will continue to have, is unable to do that and will continue to have persistent inflammation, persistent immune suppression. If this goes to the other side, it becomes immune suppression, and you can have also activation of some even of the our bodies have resident viruses there that are not active, get activated, and even secondary infection, and that can lead to death. So the most favored pathway is towards this recovery, able to correct the immunologic response just to the right extent. Okay, now. Having recovered, now it depends on how much damage was done before the recovery occurred, then you can have residuals. Okay, and most of the time though, the residuals are not much unless one gets a very bad damage in the target organ. So we have seen patients with whiteout lungs. So when they recover, it really takes time, and they may have some residuals. Also, the fact that sometimes we give interventions like mechanical ventilator that can actually cause some damage by itself, because this is an artificial way of supporting breathing. Then you can get a residual from that. Okay, so those are the some mechanisms why symptoms can persist, either from the intervention or from the extent of the damage that was done before. And I mentioned the lung, but the other organs are probably just as affected similarly. The initial damage by the virus, by the immunologic response to the virus, and the treatment for that also can affect, as well as our mechanical intervention. And let me look at the example in the heart. Okay, as this is going on in the body, so you have a virus that got into the lungs, created a problem in the lung, decreasing oxygen and creating increased pulmonary pressure. And then this virus also goes to the heart, and the heart now is also directly affected, but now has to contend with the effect of the lungs, of the hypoxemia of the lungs, resulting in a double whammy of effect on certain organs like the heart. Now, fortunately, the heart reserve is also large. And in many cases, this kind of residual or damage to the heart is not obvious at the start. But when some analysis or manifestations happen and already post-COVID state and work up, then they have seen residual myocarditis happening there. And this myocarditis actually takes a longer time. Now, this has some implication because, in general, and I have some friends who actually did this, and they try to exercise because they want to get over, because their lungs are already better, the oxygen is better, but they didn't realize that there was a damage also in the heart. And in the process of exercising and trying to recover in a damaged heart, in the situation where you have a acute damage of the heart or recent damage of the heart, we don't over-exercise the heart. That's why, for example, acute myocardial infarction patients are not allowed to do that much effort immediately. But if they did not know that and they went on to exercise, run, the way they used to take morning exercise, then they can get into trouble. And I guess some of them actually get into problems, including death. So, and the medicines that we used before actually also harms the heart. So we can have this situation happening in that organ, both directly from the effect of the virus itself, from the effect of the other organs affecting that the heart again, as well as the medications that we use. Now let's look at the brain. Now the brain also, around the brain there are blood vessels, and we have also ACE2 receptors. And of course we can have direct effect of the virus of the brain. Also you have clots forming in the vessels because they have ACE2 receptors, and that can lead to stroke. And then the respiratory effect, the hypoxemia, can also affect the brain. And the medication that we use, sometimes, we have to turn patients on their tummy, prone position, like the one shown in the picture, just so to improve a little bit more the oxygenation. And in this, for the patient to tolerate this, it has to be on deep anesthesia. And sometimes that can also, affect some of the brain. And all this can be potentially causing some residual effect of the brain. And Dr. Gap is here, and he can actually tell us a bit more of this. Now, this is a common story that those who had severe COVID, they had to be in the ICU, actually will have more neurologic deficits and actually have poorer performance in psychological tests because of the severity of the illness, okay, and the effect of the COVID. Now, this is, I think, my last slide to just show that more recent research has shown that there may be other factors that triggered by the virus that and some predisposing situation in the host that can actually predict who will develop long COVID or persistent COVID manifestations even after the viremia is gone. And this is early days, but they have looked at the biomic metabolic situation in the lungs, in the flora, as well as in the GI tract. They have looked at antibodies. There are some autoantibodies produced. I mentioned latent viruses, including the Epstein B virus, and so on. And we are waiting for the results of this. But guys, we are out of the pandemic, but we have still to contend with what the pandemic as an offshoot sequela has shown. And early days means we don't have proven therapies. So the advice we can only give to our patients is they feel something, they have to consult the doctor. The doctor will have to find out if there's something there in addition to just being post-COVID. And if this is really post-COVID and specific therapies are not available, then you might want them to actually do this, a graduated exercise or eat healthy diet, and, avoid alcohol and other unnecessary drugs, have a good sleep and duration, and maintain your brain. Like you read a novel, you engage in music and so on, and keep up your social life within, of course, limits. So thank you very much for the attention.
Okay, thank you very much. That's Dr. Camilo Roa. Salamat, sir. Naku, laging ganda ng presentation ni Sir Milo eh. I'm going to watch it again, no? I want to watch it again, and I'm sure you're going to see, sir, in the chat box how the audience appreciates your presentation. Raymond, over to you.
Thank you, Dr. Susie, and thank you also to our academician, Roa. Maraming salamat po, sir. Marami po kaming natutunan. Please stay po, no? Kasi we have Q&A right after all of the talks have been in, especially after our reactor po. For our next speaker, isa rin po sa inyong mga paborito, suki na rin po natin siya. Very, very busy person but always makes time for us. Thank you po. Ang ating pong, if our first presenter po was on our very first episode of this webinar series, our next presenter naman po was on our second episode of the Stop COVID Deaths webinar series po. Talagang parang destiny po na naka-line up po sila. She is trained in clinical epidemiology and infectious diseases. So siya rin po ang head ng Hospital Infection Control Unit sa Philippine General Hospital. But before we forget po, we'd like to congratulate her for being selected as one of Asia's People of the Year for 2022. So maraming salamat po to Dr. Berba.
Ganda ni Nina dyan, grabe.
Maganda nga po. Hindi lang po tayo ang nakakita nito, but also those from Saudi Arabia, Caribbean, Netherlands, from the Ministry of Health in Oman, from Brunei, Vietnam, Malaysia, Taiwan, Saudi Arabia again, UAE, from Algeria, Fiji, California, Australia, Canada, England, and the Netherlands, Antilles. So marami pong nakapanood po noon at really we are deeply honored that all of you who are doing excellent service po to our country are here to share your knowledge po. So without further ado, I'll turn the floor over po to Dr. Regina Berba. Ma'am Nina.
Hello everybody. Biglang ninenervyos tuloy ako.
Ang ganda eh. Ang ganda-ganda.
Ang ganda kaya.
Ang ganda. O, di ba?
Oh, parang naligaw. Anyway, I'll share na my slides. Okay, wait lang. So, thank you very much for having me again today. Ito naman po ay tungkol sa COVID-19 reinfection and I'll be showing talaga the PGH data because that's what we have so far. So as you have, binilang ko rin nga kung ilang beses na ako na guest dito sa UPTV and I'm very, very honored each time you invite me. So as you know, as in the past, I always share with you what we've learned so far at the PGH. We're a COVID referral center. We continue to be a COVID referral center. Very much decreased na yung number of cases that we've been seeing. Pero yung show ko po siguro, the more important part is how our healthcare workers have been in the last 12 months. No? So as we sort of mirror what happens in the national scene, no? So pagka parang dumadami sa community, dumadami rin yung mga nagkaka-COVID among the healthcare workers. Pero ito through the months, you would see, kala namin so parang kinolor code ko dito, we've been through so many surges and variants. So yung mga yellow nung March and April, just as we were starting to roll out the vaccination program, dyan din parang biglang lumabas na yung mga alpha and beta. We used to call them the UK variant at saka yung South African variant. No? So na-affect kami nun. Plus, come August and September, again, you saw umakyat na naman yung numbers. This is the Delta variants. Kala namin sobrang na-overwhelm na kami nito nung mga there were days we had about 30 at most new infections among healthcare workers. Pero pagdating talaga nung January, grabe, this was so overwhelming. We would have as many as 50. There was a day we had like 150 healthcare workers sabay-sabay nakita na may infection. So yan yung green part that appeared towards the end of towards the start of this year. But I'm supposed to really talk about reinfection. Ito kasi yung, parang ito yung background, no? So this is back to back with our efforts to vaccinate almost everybody in the hospital. So this is how it's been kasabay nung habang nangyayari yung mga COVID infections, nagkakaroon rin ng vaccination, very, very aggressive. We try to like cover as many as we could with the healthcare workers, lahat ng eligible. And actually, yung natitirang mga 3% dito, yan na lang yung mga we're trying to just make sure what their doses have been, what their dose dates have been. And these were the different kinds of vaccines that our staff has received. So in terms of infections, ito yung parang nakita namin when we look back at how we've been doing. So we registered about 3,000 plus healthcare workers na over a denominator of about 6,000 staff. So over 50% ang nagka-COVID in the last 2 years. No? In them, we noted na merong mga 285 ang more than one infection. Actually, 276 yung nagkaroon ng 2 COVID infections at saka 9 yung initial na nakita namin. Pero when we were trying to confirmed these infections, there were 7 healthcare workers who actually had more than 2, nagka-register sila ng 3 confirmed PCR tests na nag-positive. No? So what are the characteristics of those who had multiple infections? When we tried to look at them, there were really no difference in the assignments kung COVID versus non-COVID. Kasi parang logically, isipin mo, siguro yung mga na-infect mas madalas, baka sila yung nag-work sa COVID. But it didn't seem like that. There were also no differences that we noted sa nurses versus doctors versus other paramedical staff. But we did see that on recurrence, ibig sabihin yung second time sila nagka-COVID, if they were moderate COVID dun sa first infection, they were mostly mild or even asymptomatic on recurrence. As some of you may know, we have like a study going on vaccine effectiveness in PGH. So some of the staff, we had them volunteer for antibody testing. And we didn't see any differences in the trends of their antibodies. Kung mababa ba, yun ba yung mga na-infect ulit o tsaka yung matataas, hindi na-infect. So parang walang difference in individual antibody trends. And eventually, lahat ng healthcare workers who were initially parang nagkaka-reinfection were vaccinated. Dun sa 7 na nagkaroon ng 3 times, all of them had an infection noong June during the Omicron surge. And among those whose PCR tests we sent for genome sequencing, these were the different variants that we noted. So parang hindi kasi lahat na genome sequencing, but these were the different ones that were noted among those who had reinfections. Parang madaming ang nagka-Delta. And I'm sure when the results of the genome sequencing for January and February would come, most of them will really be Omicron. So why do reinfections occur? So reinfection has been defined by CDC and also by the UK health systems as somebody, parang in a layman's term, na-infect, nag-recover, tas na-infect ulit. And CDC would define this as dapat the difference or the period between the first and the second infection should be more or less 90 days apart or 3 months apart. So yan yung parang consensus definition of most health systems. And the reinfections, yung nakita natin and na-experience natin here in PGH, and I'm sure in your different institutions, were similar to what was experienced in other countries. No? So particularly during the Omicron surge. So that makes us think that reinfections happened a lot because of the evolution of variants. So variants allowed, so this is one of the main reasons, the variants allowed the viruses to have increased transmissibility. And the occurrence of the variants, the mutations that happened, allowed these viruses to evade the current immune system of the host. So there was an increased ability to escape recognition of whatever immune system of that host has been. So ito parang nakita to sa UK. Dito nga sabi nila 650,000. No? So from a baseline of about 1% reinfection, during the Omicron surge, there was really an increase, a marked increase of reinfection rates of at most 10%. So the other reason, so yung isang malaking factor yon. So pag nagka-variant ulit, baka magkaka-surge ulit ng reinfections, lalo na kung very multiply mutated yung virus. The other one is related to the immune response of the host. So definitely there's some impact of a previous infection and the presence of vaccination status. No? So what do we know so far? sabi sa current evidence, individually, fully vaccinated individuals, and then also those who have been previously infected, they already develop some kind of a good immune response, robust enough that there is a reduction in the risk for reinfection for at least 6 months. Ito yung sinabi ng CDC. Pero ano yung exact antibody threshold? Kasi yun rin yung hinahanap namin sa aming data. Parang wala talagang makadefine ano yung exact antibody na we need to achieve, no? Kaya dapat hindi na tayo talaga on an individual basis trying to get our antibody levels, no? So it looks like both vaccination and prior infection would make you immune. Pero this is not 100%. No. Again, the antibody titers seem to correlate and give us that reassurance that there's some protection on a population level. So for example, yung sa PGH now, we're testing several people and looking at the trends. We see na talagang after vaccination, tataas, tapos bababa over time. But there's no exact titers. So on an individual level, I urge you not to do that anymore, not to ask your staff on an individual basis or your patients to get their antibody levels kasi ang hirap i-interpret. So just rely on researches or large cohort studies to give us more information on this. Tapos the third box here tell us na the antibody titers are really very, very varied, no? And but it looks like basta merong primary vaccine series, so kunyari na tapos na yung dose 1 and dose 2, there's really a high correlation with high enough antibody response to protect us. The other things that is known so far, there are certain populations na kahit i-measure yung antibodies, parang hindi makita, parang mas mababa, no? So that's why when some patients tell us, bakit when they continue to not want, to hesitate being vaccinated, they would say, kasi pumatanda na ako ganun. So parang nakakalito for some individuals, I think. They think dahil matanda na sila, hindi na sila eligible for vaccination. On the contrary, dapat nga, the more vulnerable they are, so more immunocompromised or elderly, the more we ask them to get their vaccines for increased protection, even if overall, hindi makita sa mga antibody responses. No? It's still better than no vaccine. And as I said kanina, the evolution or the emergence of new variants, parang nahihirapan even the vaccines and our current immune states to give us full protection. Okay. Pag i-weigh mo, kasi yung mga kontrabida, di ba, sasabihin nila, maghihintay na lang ako magkaroon ng infection rather than vaccine kung ayaw nila talaga magpa-vaccinate. Pero when you look at the body of evidence, talagang parang mas strong, mas consistent yung immunity, the strength of the immunity that happens after a vaccination. So let's not get into that argument na, sige papa, maghintay na lang ako magkaroon ng infection para magka-antibody response. Let's not even start or get into that argument kasi hindi ganun yung evidence. So, basta alam natin, so sa mga na-reinfect, sa mga audience natin, as was noted, parang marami nga na we had that experience of getting multiple infections over the last several months. No? Just be affirmed na nagkaroon talaga kayo ng mga antibody responses. So here, it says na yung B responses, B cell responses, produces that kind of neutralizing antibodies that sort of persist maybe up to 6 months Ang longest, mga 8 months. Tapos there's an equivalent increase in the T-cell response also. Minsan lang talaga mahirap i-measure sila lahat. And to protect ourselves from reinfection, we still say na dapat magpabakuna. And that the bakuna, even if there's some reduction over time, there's still strong protection against hospitalization, severe disease, and death. And of course, yung consistent practice of precautions. No? Most of us in the audience here probably belong to some kind of health institution or health practice. So sa PGH po, kahit na nag-alert level 1 na dito sa NCR, we opted to really be cautious. So even if we allowed face-to-face activities already, I think it's important for us to keep in mind and always remind our staff and everybody around us to continue to be vigilant. Yung practice talaga, it's one of the main things that we need to remind ourselves and remind everybody. So prepare, be vigilant. Since we've been in this together, kailangan talaga sama-sama pa rin tayo trying to protect each other. So we continue to, at this time, parang interim recommendations to maintain all the PPEs on board until we see talaga that things are under control or until the pandemic really, really ends. So yun. So for all of you who's listening to us, it's important talaga to, eto nga, we keep on like releasing infographics para yung mga staff natin is they remember all of these precautions and they keep in mind. Usually kasi pagka parang iba-iba na yung naririnig nila, and especially if they're exposed to a lot of other things in the social media, for example, they get different messages. But if you just keep them focused and remind them of what's important to protect themselves and the entire institution para everybody's safe, you have to like really take an extra effort to make the infographics really attractive at saka parang madali mas save sa phone nila or sa laptops nila. So that's part of good communication. So this is my last slide. What should we still advise to all our patients? Meron tinatawag na term yung super immunity, no? So yun nga, sa mga nagkaroon na ng, even among those who have been previously infected with SARS-CoV-2, even those who are vulnerable, basta eligible for the vaccine, that's an important and significant and crucial critical part of our COVID response, yung vaccines. That's it na po. Thank you very much.
Okay, thank you very much. Nina, again, very nice presentation, no? Tsaka talagang direct to our frontliners. Mukhang kailangan pa rin nating mag-ingat. We have to be vigilant, but very, very, what should I say, a very, very evidence-based presentation based on your data in the Philippine General Hospital. I'm sure our audience is learning a lot from this. Okay, so Raymond, did you want to, ako bang mag-introduce sa next?
Sige po.
Sige, okay. So our next speaker is a reactor, okay? And you've met him before. In fact, when he was on the webinar, siya admitted sa PGH noon dahil nagka-COVID siya. No, so we'd like to welcome the Chancellor of UP Diliman, Dr. Fidel Nemenzo. Fidel, welcome to the webinar and good to see you here.
Magandang hapon, Doc Susie and Doc Raymond. Do you hear me?
Yes, sir. Yes, sir.
Pero you can take out your mask, Fidel.
Kasi may dumaan kanina dito kaya.
Ilang beses, Fidel, may I ask you, how many times did you get COVID?
Ako, 3 na.
3. O sige, we're going to listen to your story. Sige, go ahead, please.
Susie and Raymond, congratulations sa 90th webinar na pala, no? Napaka-importanting public service ng UP Manila at ng TVUP. Nakumusahin ko rin ng kaibigan kong si Doc Gap, isang kapwa 3-timer ng COVID, no? And hello Dr. Berba. Dr. Berba was one of the doctors who actually saw me during my hospitalization. No? Tumutulong din siya sa COVID response activities namin sa UP Diliman. At congratulations, Dr. Berba, for being chosen as one of the people of the year. Si Doc Ro 101 was my father's doctor. Pasensya na, magpapasalamat mo na ako. Ano? Maayong to, Doc Ro, salamat kayo. Congratulations for your well-deserved recognition as a NAST academician. No? Gaya ng nasabi ni Doc Susie, 3 beses ako nagka-COVID. No? Last year and early this year. So that was May 2021, September 2021, and January 2022. No? Binilang ko kan pala to talagang eksaktong 4-month gaps between the COVID bouts. No? At bukod sa 3 times ako nagka-COVID, tingin ko meron din akong symptoms ng long COVID, no? From the second one. No? So kaya medyo natakot ako nung pinapakinggan ko si Dr. Milo na when he was talking about the long-term effects of COVID, at sabi nga niya, no, medyo minsan at inaabot ng mahigit 3 buwan, 6 na buwan. No? At minsan nag-worsen ang conditions, kaya medyo nakakatakot din pala. No? Kaya mahalaga talagang pag-ingatan ng katawan. No? Kakaiba ang magkaroon ng COVID dahil dati hindi ko talaga maisip na magka-COVID ako. Nung naging Chancellor ako ng UP Diliman, March 2020, talagang kasagsagan nung unang lockdown. No? Kumbaga, it was the COVID pandemic that really gave me a welcome into my job as Chancellor of UP Diliman. It was really an immense challenge of leading a university at a time of disruption dahil walang mga templates, no previous experience to draw from, at walang mga how to do manuals. No? Kaya talagang you learn along the way and you just learn from experience. No? Sometimes trial and error, but of course this is a community of academics. No? We also look at data and base decisions on data. Napaka complex ng problem dahil ang UP Diliman ay napakalaking university, hindi lamang estudyante, kawani at faculty. Meron ding mga residential communities. Iba-iba ang kanilang mga interest at talagang lalo pa sa panahon ng pandemya, may mga balancing act na nagaganap. No? But of course, aside from trial and error and learning along the way, we really gathering of data and gaining insights from data was really important for us. And we took advantage of the multidisciplinary, the range of expertise that we had in the university. So our task force, we really brought together different minds from different disciplines, no, to help us make decisions along the way. That then talagang medyo nakakatakot ng umpisa dahil we were confronting a different type of situation, a different kind of enemy. No? Habang isa-isang nagkakasakit ang ilang mga faculty at kawani at ilang nga silang namatay nga, medyo alam namin yung gravity, yung bigat ng problema. No? Noong una nagkaroon ng mga transmission sa aming health workers dito, medyo nag-react pa ako, pinagsabihan ko pa ang aming University Health Service, no? Why did you put your guards down? Nagkaroon ng hawaan sa University Health Service namin dahil sabay-sabay nga silang kumakain. No? Kahit na pinagsabihan na kami ng mga kasama mula sa PGH na mag-ingat sa mga kwarto kung saan kayo kumakain at kung saan kayo nagbibihes, no? Dahil dito nagaganap ang transmission. No? Kaya sabi ko sa aming mga health workers, nako, sa lahat ng tao, kayo pa ang magiging mas kampante, no? Kayo pa magkaka-COVID, no? Dahil dapat pinapakita natin yung mga tamang protocols. No? Pero kaya panayang reminder sa community, kaya kakaiba, medyo disturbing para sa akin. Ako mismo ay nagka-COVID. No? Alam niyo, bihira ako lumabas. No? Hindi kagaya ng ating mga frontliners, lalo pa si Dr. Gap na gaya ko 3 beses nagka-COVID, na alam ko lagi siyang nasa PGH. Na ako bihira ako lumabas dahil marami sa mga meeting namin dito, halos lahat ay naka-Zoom, no. Maingat ako, ang aking lalo pa praning, ang aking asawa, in a sense magandang ang praning siya dahil sa pamilya namin siya na lang ang hindi nagkaka-COVID. Pero bagamat bihira akong lumabas, ganun pala, no, wala talagang assurance na hindi ka magkaka-COVID, no, unless you cut yourself 100% from the physical community, the community out there. I had my first bout of COVID in May 2021. I really didn't know what to do because this happened between my first and second jabs of vaccination. Ang sabi nila, magte-take effect lang ang bakuna a few weeks after the second jab, no. Pero minalas ako, nagka-COVID ako nung pagkatapos ng aking first jab, and it turned out, looking at my activities, I was infected before my first jab, and just got my RT-PCR, my test, and the test results after the first jab. I think, correct me, doctors, maybe that was the alpha or the beta variant. That was May 2021. Wala akong severe symptoms, no? But I did notice shortness of breathing. I did not have fever, but I always felt feverish. And during my meetings, my colleagues who I had meetings with noticed that I had difficulty breathing, and sila mismo nagsabi na, uy, magpatingin ka na, no. I also talked with Gap, and ang sabi niya, I suggest you go to the hospital. So I spent about 10 days in the hospital. I have comorbidities, no, hypertensive ako. And in the hospital, although I never had the severe symptoms, no, bukod dun sa early symptoms of weakness and a feeling of fever and shortness of breathing and very slight coughing, ang problema ko talaga at that time was anxiety. I had difficulty sleeping at night kasi laging sinasabi sa akin, ingat ka, binabantayan ka namin dahil in some cases, after the 10th day, things can take a turn for the worse. Nakakatakot pala yun, no? Nag-anticipate nga, no? na at some point in your hospitalization, no, things can actually take a turn for the worse. And I've heard so many stories about those who have died, who actually felt that everything was okay, you know, at the start of their COVID infection. So it was severe anxiety that I was battling with. Also because this was an unknown condition for me. Even though I was not intubated and mukhang ang sabi ng doctors and were between mild to moderate ang symptoms, no? Nakakatakot dahil hindi mo alam ang maaaring mangyari at marami kang nabasa o narinig ng mga kwento ng ibang tao na talagang dumaan sa matinding infection, no? I had my second bout. No? So after my first bout of COVID, I then at the end of the month of May 2021, I had my second jab. You know? I got different opinions on how my first bout of COVID would affect the effectivity of my vaccinations. No? Kasi nandun nga between first and second jabs. May nagsasabi naman na baka kailangan kong ulitin ang aking vaccination in the proper order. May nagsasabi na hindi, my COVID just help increase my antibodies. No? Anyway, I got my second bout of COVID in September 2021, 4 months after my first bout. Ito sa kasagsagan ng Delta at sabi nga ni Gap ay i-assume mong Delta to dahil mukhang pareho ang aming mga symptoms. No? I had fever, very intense headaches. Nagpa-hospital ako. Nung unang mga gabi, nahirapan ako matulog dahil lang sa sakit ng ulo. Maya't maya yung ubo, hindi ako nagkasipon. Bagamat okay ang aking O2 levels, ay nandun ang talagang nakapanghina sa akin yung hirap akong matulog, no, dahil na sa sakit ng ulo. When I recovered when the headaches, when nawala yung headaches ko, syempre pumasok naman ang boredom and then the usual anxiety. I continued with my meetings from PGH. I think, Doc Susie, this was around the time when I joined one of your seminars. I also needed the meetings because sometimes being cut away from the world, adds to my anxiety, because I always think of things that need to be done. But what was strange about my second bout, ito yung Delta, ay pagkatapos nung nag-recover na ako mula sa intense headaches, after around 1 week, I lost my sense of smell. Medyo kakaiba pala yung mawala ng pangamoy. May panlasa ako, pero yung pangamoy talagang nawala, pati yung kinakain ko, hindi ko maamoy. Ang kape, hindi ko maamoy. Ang mga amoy ng banyo, hindi ko maamoy. At when one day before I was supposed to be discharged, I had diarrhea. So my confinement in PGH had to be extended for 4 more days. Itong second bout ko ang umpisa ng long COVID symptoms. I had shortness of breathing, lagi akong hinihingal, especially during certain times of the day. Persistent yung fatigue. Usually in the afternoons. Sometimes I just explain this as dahil pagpagod sa trabaho. Pero nag-umpisa to talaga nung pagkatapos ng second bout ko, yung mas persistent. Kaya sinabi ko baka nga long COVID, dahil kapag nagbabasa ako ng mga articles about long COVID, ito nga ang aking nararamdaman. May occasional body pains. Minsan I explain this away by saying, siguro edad ko yan, dahil sumasakit ang likod, sumasakit ang mga paa, ang mga binti, pero baka nga bahagi ng long COVID ay yung brain fog. Paminsan-minsan nagkakaroon ako, pero inisip ko baka rin dala ng edad o dala ng pagod ng pag-iisip. Sa gabi nagkakaroon ako ng bouts of anxiety, and at some point kumukuha ako ng sleeping pills. I still have my box of sleeping pills in my bedside just in case I have difficulty breathing. So that was in September. Yung sense of smell ko, itong pinakamatagal, unti-unting bumalik. I started smelling food, liquor, coffee. Pero until recently, hindi ko talaga maamoy ang mga foul smells. Kaya sabi ko nga sa iba, kahit okay lang sa akin, hindi kayo maligo dahil hindi ko talaga maamoy. Ngayon na nararamdaman, parang nakakaamoy na ako ng konti, pero hindi yung nawala na yung acute sense of smell na alam kong meron ako dati. That was in September. Ngayon, alam nila Gapto, I had heart problems in October, which caused me to be hospitalized again. I do not know whether this is a result of COVID, because this came 1 month after my second bout of COVID. Akala sa heart center ay heart attack, pero nung nagpa-test ako sa PGH, ang sabi nga nila, it was unstable angina. I was scheduled for my angiogram and angioplasty. But when they looked at my heart, they saw blockage in my LAD artery, 50 to 60%. At ang sabi nila ay maaari namang in the meantime, let's address this using just maximum meds therapy. I do not know whether has to do with COVID, but because I've read that COVID does weaken certain organs in the body. My third COVID came last January, no? Panahon ng Omicron and most likely Omicron. Hindi asymptomatic ako, no? Pero dahil napraning ako, nalaman kong may isang taong nasa isang kwarto na pinuntuhan ko ay nag-test ng positive kahit na malayo siya, ay medyo napraning ako, nagpa-test ako at gulat ko nung nalaman kong positive, no? Nagulat ako dahil pagkatapos ng 2 COVID na nabakunahan na at boosted na, gaya nga ng nasabi, diba? Akala ko ay punong-puno na ako ng antibodies, no? Kaya anyway, mapalad ako dahil hindi naman talaga naging severe at napaka-mild ng symptoms, no, ng Omicron. I had some coughing, my fever never really hindi naman talaga tumaas ang fever ko, no? Pero yun, kasabay ito nung patuloy na nararanasan kong symptoms ng long COVID na mula dun sa second bout ko. So those were my three bouts of COVID plus my cardiac episode in October that I still don't know, what caused this. Anyway, so since then, it's really just been an experience of learning lessons. My first lesson, never put your guard down. Never be complacent. No? They say that I'm full of antibodies, but after COVID 1, 2, and 3, hindi ko na alam, no? Whether I'm really full of antibodies or whether a new variant would arrive and put my health at risk again, no? This is really a long battle, and we learn along the way, no? Even as I also belong to the UP Diliman COVID Task Force. Na ang mahalaga lang dito, nagbabago sitwasyon, and we really just have to learn our lessons along the way. We need to be agile, with our responses. We need to be ready to shift our ways of doing things and never put our guards down. On a personal level, this experience with COVID, and of course that cardiac episode really gave me an acute awareness of the limits and infirmities of the body. Minsan mahirap tanggapin na humihina na, may illusion kasi ako minsan na malakas pa ako gaya ni Dr. Gap. Now, I really led an athletic life. When I was young, I survived a life-threatening injury. Sabi nga nila masamang damo, no? Pero wala pa lang na-exempt dito sa mga sakit na ganito, lalo pa sa mga bagong disruptions like COVID. Napaka-disorienting, no? And but of course the good outcome here is that it made me more careful, made me more conscious of the habits of things that I put in my mouth. It made me do long walks more. And there's really no choice but to become philosophical about this. Now, life is really short. We never should take our health for granted. We need to learn our lessons along the way. We need to live the lessons we learn. And every day we make decisions and choices with these lessons in mind. So, and it has always made, and I mean, this is what I want to do. It's really to live every day with intention, because we do not know when the next disruption and the next variant will come. And these disruptions usually upend our lives. And so we just need to adapt and be as resilient. Anyway, ayun lang. Marami pa akong questions about my COVID, especially my long COVID, Dr. Roa. And one of these days, I want to get insights from our doctors who have learned, who are studying the experiences of COVID survivors with long COVID. Yun, maraming salamat po.
Okay, thank you very much, Chancellor Fidel Nemenzo, for a very, I would say, very personal and I would say a touching story of your journey and for being very candid, sharing about your feelings and what you went through. And maybe at our panel discussion, we can talk a little bit about, how do you know if something is caused by COVID or something else, right? Marami tayong mga tanong eh. Anyway, thank you so much, Chancellor Fidel, and I'm sure our audience also appreciates your candor and your willingness to be open and vulnerable to our audience. Thank you so much. Okay, Raymond, over to you.
Thank you, Dr. Susie, and thank you again for such a detailed na pagsasalarawan po, Chancellor Fidel. Before we ask our panelists po, Dr. Roa, Dr. Berba, and Chancellor Nemenzo to switch on their videos so we can begin our Q&A, we will be having what we call our special public service announcement for today.
Sigurado ka na ba sa reservations natin?
Oo naman.
Bakit bihis na bihis ka?
Oo, magiging escort mo ko eh.
Mukhang may date si Lolo't Lola.
Ilagay mo kaya ito?
Ang ganda naman.
Maganda yan. Special ang lakad natin. Ano, ready ka na?
Ready na. Mom, Dad, aalis si Lolo't Lola. Oo, anak, after lunch. Sana lakad niyo po. Para sa atin lahat ito. Magpapabakuna kami dahil mahal namin kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by the UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the PCHRD of the DOST and the Department of Health through its AHEAD HSPR project. Over to you, Dr. Susie.
Okay, thank you. Thank you so much, Raymond. All right, so we're going to ask our panel to come in. I think Gap had to leave. He had an emergency, but we have Dr. Milo Roa and we have Dr. Nina, and we also have, of course, Chancellor Fidel Nemenzo. So, Sir Milo, I think I'll start first with Dr. Roa. I think from the sharing of both Gap and Fidel, Chancellor Fidel, yung naglalaro talaga sa isip is, if you had COVID and then you get sick again, how do you know if that's post-COVID or long COVID or a completely different illness?
Yeah. Susi, sabi ni Nina, 3 months, Nina, di ba? You have another positive. After being negative, you can classify it as another COVID bout. But then long COVID can actually span across 3 months and pwede na sila mag-overlap. Now, so some of the manifestations, including yung natakot. I mean, who is not matakot? When you're COVID, you are feeling not so well. You understand that this can be very bad in some cases. You have friends who suffered, and those things, and you are alone in your room because you are isolated. Those things conspire to create an imprint in your mind, so that when you have it again, a mortal can just fall into this thing that simply matakot ka. Those things can come play again in your mind because you have another bout now.
Yeah, I think, Nina, did you want to comment on that? Like, aside from reinfection, right, other symptoms, kasi like what Chancellor Fidel said, no, sa kanya nagkaroon siya ng heart problem, without wanting to put you guys on the spot and making a guess. But how do we more or less, if we're talking to our frontliners now, right, and let's say meron silang nagka-COVID sila at meron silang nararamdaman na kakaiba na hindi COVID, no? Anong advice natin sa kanila?
Oo. Ako, kasi Chancellor Nemenzo, talagang maraming data rin on yung cardiovascular effects of COVID-19. So I wouldn't really discount the fact na baka related. Pero I think overall, the the management would be the same. Hindi na rin nila, your cardiologist wouldn't like dwell into it. They'll really just manage you kung ano yung kailangan nyo for your current status. Yun na rin yun. Parang isa sa mga differential mo, o baka this is a part of the complications of COVID-19. But perhaps kung nasa tamang age ka na, di ba, at risk ka na talaga for a heart problem, pwedeng it's part of our, hindi ko naman gusto sabihin aging process, pero it's part of getting...
Part of becoming wiser. O, di ba? It's part of becoming, full of wisdom.
Yes, maturing and gracefully aging, that's all part of it Pero syempre, kaya naman observational studies are trying to find out more about this. Kasi nga, gusto rin nila i-advise yung population na, pag meron kayo naramdaman, don't shrug it off as just something irrelevant kasi natapos na yung COVID nyo. Kailangan parang i-pursue, go to your doctor and have it diagnosed and evaluated well. Yun po yung sa-suggest ko. Parang yun nga, don't shrug off. Sometimes kasi kala natin, pati po pag nakipag-usap kayo sa mga pasyente, maraming things na parang niisip nila, wala yan, ganyan lang yan. Pero minsan, pag habang kausap mo, naririnig mo na they sound short of breath, there's hingal in between the statements habang kinakausap mo sila. So, parang yun, kailangan lang babaan talaga yung threshold for taking care more parang more vigilance in how we perceive things. Especially kung healthcare workers tayo kasi kailangan alagaan natin talaga sarili natin.
Correct.
Yeah,
So,
I guess,
Dr. Roa, go ahead. Sige, go ahead. Kasi alam ko may kinukwento kayo sa akin na, remember when we had that meeting the other day na sabi niyo meron kayong pasyente na nagkakaroon ng symptoms, sabi niya, ano lang yun COVID lang yun Pero it was actually something else, di ba? So, baliktad naman.
Well, probably almost on the same vein kay Chancellor Fidel. By the way, Chancellor Fidel, thank you for the kind words and regards to your family. Yes, it's very important that these manifestations should not be just shrugged off as mentioned by Nina. Well, it may be part of COVID, or it may be something else, or they conspire. If you have a arteriosclerotic vessel there, and you have something like COVID that tends to induce clotting, then that can spell trouble. 1 + 1 = 5 yan. So it's very good that the doctors in PGH were able to discover what you have, and then you are, I suppose, as mentioned by also your alluded to GAP, telling you that you should be on maximal medical treatment, that those things are being done. And so the other scenario would be hazardous na akala mo post-COVID lang, and then exercise ko lang to, and then you have problem pala a black coronary, and that could be very disastrous. And so this is the way you have people with post-COVID manifestation, and there are a lot of them, should be aware that this can happen, but should also get medical help to be sure that these are really the kind of post-COVID that goes away, or the kind that we worry because of the intervention that was made before, or this may in fact be another disease. And as I mentioned to you, Susie, before, we had a patient with infiltrates in the lungs, and it persisted the COVID, acute COVID phase. And so sabi, baka post-COVID lang yan, or the lung taking time to recover. Magto 2 months na, and then the patient was actually getting worse. And then after going through the CT scan, because he had several CT scans, or by the way, doctors, there was an area where the aeration was much less. So the astute radiologist said, maybe let's biopsy this area. And lo and behold, it was adenocarcinoma, the alveolar carcinoma site. This is the kind of adenocarcinoma of the lungs that mimics a pneumonia or a post-pneumonia state. And so that's very important to discover. And also, we have, Nina, di ba yung mga immune-compromised patient natin, they can have pneumocystis carinii and akala mo COVID lahat yun, yung pala there is another thing that is causing the hypoxemia. So it's very important to consult the specialist, the doctor, for things like that really bothers. And if there's really none that is seen, then the advice, yung mga healthy advice that can follow will also be important as we get to know better this post-COVID condition.
Yeah, thank you very much, Dr. Roa. I mean, ano talaga, as we progress, we learn more. I was going to ask Chancellor Fidel if he wanted to ask Dr. Roa or Dr. Nina any questions. By the way, Chancellor Fidel, your father and my father were sick at the same time, and Dr. Roa, lumalagari yan between our fathers. Sir, naalala nyo? Diba? Naalala nyo yun? Sabi ko, nako, talaga naman, Anyway, sige, Chancellor Fidel, did you have any questions for Dr. Roa or Dr. Nina?
So is it true that after 3 variants, so I have the Wuhan variant, the Delta variant, the Omicron variant, and then I'm fully vaccinated twice and boosted. Is it true that I'm full of antibodies? Totoo bang punong-puno ako ng antibodies? Una-una, ayaw ko i-assume yun dahil dapat naman talaga ingatan, mag-ingat talaga at hindi pwedeng maging kampante, no? Pero totoo nga ba na napupuno, may extra protection?
Baka may superpowers ka na.
Oo, I'm sure may superpowers ka na, Chancellor. Pero
akala ko yan
talaga. Yeah.
Yeah, pagkatapos ng second ko, akala ko nga may superpowers, hindi naman pala, no? Nagka-third pa.
Oo, except kasi po, dynamic kasi yung state natin and this antibodies or our immunity has been seen to really decline over time. Kaya yung parang estimate po mga 6 to 8 months. May mga nagtatanong sa chat box kung kailan yung next booster. So wala pa pong advice ang WHO or ang Department of Health, but I think they're studying that in our experts panels of the vaccination program will maybe advises. Pero yun po there are definitely parang mas definite yung decline in antibody levels after a natural infection. Parang mas steady siya after a vaccination, but both over time will reduce, will go down. Yung both antibody levels at saka siguro some kind of T-cell responses. So yung mga immune levels, hindi siya static bababa po siya. So even if at some point super immune na po kayo, after a while bababa yan. Kaya po nagka-booster, kaya pinupush talaga yung booster doses.
So ba kayo? Do you suggest that you recommend another round of booster shots for those who have already been boosted?
Parang I think we need to wait kasi we need to also standardize. There's also a problem, gusto rin natin as many of the primary doses are given, diba? So marami pa rin po kasing hindi pa naka-receive ng first and second dose. Parang yun po yung gusto natin ma-fill in sa ating country to get everybody finished with their first doses. First, yung first series. Tapos pag napunuan na natin yon, we've reached 70 to 80%, then I'm sure magko-concentrate na sila with the boosters. Dito sa high prevalent areas, talagang boosters have been pushed na. Kaya, di ba, several times nagkakaroon ng vaccination days to push for boosters. Yung sunod na booster schedule, hintayin natin yung announcement ng DOH at saka ng WHO.
Okay.
Okay, thank you very much, Nina. All right,
See.
Raymond, do you have,
Yes.
Sir
Can
Camilo,
I
go
just
ahead.
ask one question? Curious ako,
Okay.
siguro maybe Dr. Roa. It's about my sense of smell. Dahil sabi ko nga gradual ang pagbalik niya, may naunang mga una kong naamoy, usually mga pagkain, pero nakakaamoy na ako ng karamihan, pero nahalata ko na may mga hindi pa rin ako naamoy. Napag-aralan na ba yan? Yung ano yung trend, ano yung process of recovering of the sense of smell?
Yeah, yes, Chancellor. So, number one, there is no treatment. It's a natural recovery, but again, the course normally is towards full recovery. It may be faster in some and slower in others. In your case, you have recovered, I suppose, 90% recovered na, ganun, and it may take a while to catch up the last 10%. But from the reports I have seen, it's good that most of the reports says that there will be fairly good, almost complete, probably complete recovery in time.
The question is, why is it that there was a time when I could smell some things and not smell other things? I noticed that I had a very weak sense of smell for foul smelling things.
Yeah, sana nandito pa si Dr. Gap, no, neurologist. Kasi the sensory receptors there, may mga iba-ibang threshold yan sa iba-ibang stimuli. Well, I don't know. We have those, di ba, yung gumagawa sa Europe, yung gumagawa ng perfume, di ba, meron silang denose na talagang heightened sensitivity to certain smells. And not everybody has that. So there's some variability.
Doc Roa, yung mga chef, di ba, magaling yung sense of smell nila.
Yes, something like that, yeah. So, okay lang. I mean, it will take time, but it will be back, Chancellor. Yeah. Now, on the issue of the antibodies and the immunologic response, our system is gifted with that ability to recognize again the same culprit if it comes along. Now, as Nina mentioned, our defenses are several tiered. Yung antibody decays, but there are others there that will come back to place in case that happens. Now, the problem is, baka the next virus is so mutated, hindi na masyadong ma-recognize ng the defense that you were able to develop before. Fortunately, itong yung coronavirus, Nina, please correct me, it does not change so much. It changes in a way a bit, like in the S protein, some areas there, but it does not change like flu. Flu, mapasama lang yata yung dalawang klaseng flu virus, mag-exchange na sila ng genetic material and they can have another daughter that is entirely different halos ng parent. Nina, can you explain to that? They say that whereas the COVID will have to be changed because of continuing replication, parang Xerox machine that takes a while to actually have some errors.
So, ganun nga po, pagka sobrang ang fear talaga natin is pag nagkaroon pa na ulit ng isang variant of concern, and this becomes really very different na from the original Wuhan at saka itong mga recent variants. And as I said kanina, there's like increased capacity to evade our immune system already. So, yun po. But otherwise, I think as a global response, kailangan natin hintayin ang advice.
Yeah, right. Okay. Raymond, do you have some questions you want to pick from our audience? We can take one.
Well, there's one question coming in. One for the infectious disease specialist and one for the pulmonologist. For Dr. Berba, does the effect or yung effect po ba ng long COVID does it differ between persons based on gaano po kalala yung symptoms po nila? So, ibig sabihin, mas matagal po ba o mas malala ang long COVID if you were asymptomatic versus if you had severe or critical COVID po?
Nina, there's no, naka-mute ka. Nina, you're on mute.
So yung parang hindi, walang ganong trends eh. Parang definitely, ang nakikita nila is the reinfections, yung recurrence of infection seem to lead to less complications. Parang ganun yung general trend. Although yung sinabi ni Chancellor kanina, parang iba yung sinabi niya, di ba? Parang he had more complications or long-term persistent symptoms after his second COVID-19. So, parang walang general trends. Yeah.
Okay. Thank you, Ma'am Nina, for Sir Milo. The other one is how likely daw po na nagkakaroon po ng lung function problems kapag nagka-COVID, at kung nagkaroon man po ng lung function problems, malabo na raw po bumalik sa dati or 100% pulmonary function.
Okay, so we are talking about the capacity of the lung to perform its work, mainly gas exchange. Yes, if you have this time very bad COVID that practically ravages the lung, and we're talking about both lungs. You know, people can survive with just one lung, but both lungs are involved, and the healing does not really result in total recovery. You have some destruction of the architectural structures, and when the architecture is disturbed, even if you populate it with surface cells like epithelium, it will not be the same anymore. Also, there will be some fibrosis that can happen, although we are not seeing here in COVID the kind of fibrosis we call idiopathic pulmonary fibrosis that actually multiplies on its own. It has its own life and gets worse. This one, if you have it, then you have it. Although most recent fibrosis can still improve. So the answer is, if the effect on the lungs by the COVID or the intervention, including the mechanical ventilation, we have damaged some of the lungs along the way, can actually result in some residuals in the lung. Now, these residuals can be seen in the X-ray if they are large enough, or CT scan, but others are not. These residuals are detectable in lung function test, although in lung function test, normality is 80%, even 80% of the standard, you're still normal because of the reserve that we have, and people think we don't really have to have 100% function. So it will be there, but in most cases, there will be a functional person after a bout of COVID. It's not very common to have a pulmonary invalid after a bout of COVID. There will be some improvement across time to the point that they can do the lung function. Now, that's different from the long COVID concept that affects like kahit okay na sila lahat, they feel something else. So that one can also linger and can go in parallel with these structural changes.
Marami pa tayong kailangan matutunan, ano. Raymond, okay na tayo?
Yes, I think we're good, Dr.
We're
Susie.
good? Okay. So, we're going to go to the fun quiz, Raymond.
Yes, so we had two questions po, no? Especially for those who are asking. Ito po ang dalawang katanungan. Can we have it on the screen for at least for Menti? The two questions are as follows. When do we consider post-COVID-19? So we'll ask this to Dr. Milo po muna. The options po are 2 weeks after acute illness, 1 week after acute illness, continuing illness, or all of the above. Sir Milo, ano po ang tama?
So the long COVID manifestation probably occurred together with the COVID, but will not be thought of as post-COVID yet because they're handling the acute process, and will come into focus after. But so I would say that all of the above is the answer there.
Okay.
Okay. The next question po is, for Dr. Berba, what is the most important precaution our healthcare workers need to continue to observe? Is it wearing masks, full vaccination and booster, physical distancing, ventilation, or all of the above po?
The answer is all of the above. The best
Thank you
answer.
so much. Thank you so much, Dr. Nina. Apa.
Okay, maraming natuwa doon ha. Parang tama sagot nila. Okay, so we're going to give our panelists a minute or two to formulate your parting words for our audience. And we just really want to thank you in advance while we do the evaluation. So go ahead, Raymond.
Thank you, Dr. Susie. Our evaluation po, ulitin ko lang po, no, wala po kaming hiwalay na inilalabas. We do not release any separate evaluation poll. This is it. So for those who will be participating, sana po makasama po kayo for this evaluation poll. It's a 4-point Likert scale. Strongly agree up to strongly disagree. The statements are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. We will not be closing the evaluation poll as we move on to the final messages of our panelists.
Okay, so we'll start first with Chancellor Fidel Nemenzo. Fidel, go ahead, please.
Yun lang ang gusto kong sabihin that you know, our vaccines or boosters and even previous bouts of COVID really will not completely defend you against the next variant that might come along. You know? So there's no better defense than really just personal vigilance. Just take care of yourself as if just realize that you are vulnerable at any time. So never let your guard down. Just wear your masks, avoid the crowds if unnecessary, eat healthily, get your sleep, just make your body stronger, because you do not know when the next variant or virus would strike.
Okay, thank you very much. Thank you very much. That's UP Diliman Chancellor Fidel Nemenzo. Okay, let's go to Nina. Dr. Nina Berba.
Ako naman, I think I'd like to leave with a note of hope. I think we've gone a long way. There's still a lot to do. There's still a lot to learn. Pero the fact na marami sa atin bakunado na, siguro nagbibilang na tayo dun sa mga immune, high levels of immunity. But then again, we need to stay abreast with the current situation. Tapos we just need to follow guidance from our experts, from WHO, from the Department of Health, and move along. Kasi parang hope na to for moving towards new normal. Yun. Let's just all be vigilant and work together. Thank you.
Okay. Thank you very much. This is Dr. Nina Berba from the Philippine General Hospital and Sir Milo Roa. Go ahead, sir.
Yes, Susie. So in addition, I'd just like to again express my personally I am welcoming the situation that the infection rates are down, and hopefully this is the last infection surge. However, also I hope I also express the message that this infection is causing some new kind of disease coming after it, so post-COVID illness. And while most of these diseases ultimately go towards improvement, recovery, it has to be emphasized that when the person feels it, get professional help so that you can be guided kung yun nga ba lang yun, or there is something else, that will make that post-COVID thing actually have more effect on the person. So be wary of post-COVID condition. And again, the better way is really attempt not to get COVID again, or not to get COVID at all.
Yeah, thank you very much, Dr. Roa. So I'd like to thank all our panelists, which is excellent. If you have a little time, there are some questions in the Q&A. You might want to do a quick reply. But now we'd like to call on Dr. Stella Legaspi Jose, who will be giving us the sort of end summary and closing remarks. She's the Deputy Director for the Philippine General Hospital. Doc Stella, please go ahead.
Good afternoon, everyone. We had a very interesting and enlightening webinar today. So there are many learnings that we can derive from it. From Dr. Camilo Roa, hi sir, good to see you. He explained about post-COVID and the signs and symptoms that are experienced by the patients, such as fatigue, breathlessness. So he said that there are 3 phases. It can be at the start, it can be persistent for at least 2 months or longer, and it can be relapsing. And the recovery phase, that it's also different. Some recover very fast, some medium, and some take up a long time. The most common symptoms, according to him, are fatigue, headache, attention disorders, hair loss. Ngayon ko lang yan narinig, sir, yung hair loss, and dyspnea. Okay, so symptoms may persist because of the immunologic response of the body. So, and the treatment that was used, for example, the mechanical ventilation, which can also affect the lung function. Natuwa ako doon sa kanyang last slide. He said, so what should you do when you get COVID? Perform aerobic exercises, according to Sir. Eat Mediterranean food, so more of vegetables. Avoid alcohol. Ayan, mga taga-UP, Sir Nemenzo, uso yan sa mga bata. Alcohol after the exam. Anyway, sleep well, social activities, and pursue other beneficial activities. Thank you very much, Dr. Roa, for those. For Dr. Nina Berba, she explained the situation here in PGH and the characteristics of those who had multiple infections. According to her, in PGH, what the HICO found out, there was no difference in the assignment of the employee, whether in the non-COVID ward or COVID ward. So it really depends on how you follow the healthcare protocols. There's no difference if you're a nurse, a doctor, or a paramedical. Most of them were mild and asymptomatic in the last surge. And there's no difference in the antibody trends. Okay? So, ang magandang mensahe ni Nina is the variants allow the virus to have increased transmission. Okay? And the variants, they avoid ang host immune system. So, let's all be careful. No? Many variants will still come along. And the good thing is, if you're fully vaccinated, you have a low chance to have reinfection. Okay? So the immunity provided by the vaccine and the infection itself, prior infection, it's good because it increases your antibody levels, but it is not complete. Current evidence indicates that the level of protection may not be the same for all viral variants. Okay, so dahil merong alpha, beta, merong delta, omicron, iba-iba talaga ang level of protection with this variant. And etong pinakamaganda niyang statement, the strength of immunity is greater in vaccine-induced immunity. So dapat lahat tayo magpabakuna talaga. And as an aside, from the start of the pandemic, I already go here to PGH every day because of my work. Awa ng Diyos, sir, hindi pa ako nagkaka-COVID. So kaming dalawa ni Nina, the last remaining, halos lahat dito nagka-COVID na, sir. Anyway, okay, for Chancellor Fidel Nemenzo, sir, I really sympathize with you, sir. Yung 3 beses magka-COVID is really, it's not a simple thing. And from his personal experience, yung breathlessness, fatigue, brain fog, difficulty of sleeping, the sense of smell disappearing, sometimes you take these things for granted, pero when it happens to you, then sir, you cannot smell the flowers, sir. Pero mukhang bumalik na naman. So, okay na kayo, sir. Anyway, when he had the Omicron, he said yung cough persistent, and that is so common to almost all the patients who had Omicron. It's the cough. Sabi nga ni Gap, ang kate-kate ng lalamunan daw niya when he had the Omicron. And the lessons learned from Dr. Nemenzo, do not take your health for granted. You have to adapt and be resilient. Thank you very much to all our speakers. Back to you, Susie.
Okay, thank you very much, Doc Stella. Ang ganda ng summary mo, di ba? Parang naalala namin lahat na sinabi.
Hindi ka pa nagkaka-COVID.
Hindi pa, oo. Mga ano tayo eh. Takot ang COVID sa atin. Okay, so thank you very much, Dr. Stella Jose, who's the Deputy Director of the Philippine General Hospital. And next week, nako, nice topic. And I'm actually glad that Chancellor Fidel was very candid, I think very open. And sabi ko nga, was very vulnerable, no? When he was talking about having anxiety. So I think, next week what we're going to do is we're going to talk about, kayo ba ay nadidepress dahil nagka-COVID kayo, or meron ba kayong kasama sa pamilya, mukhang nag-alert level 1 na, pero ayaw pa rin lumabas, or nagkaroon ba kayo ng mga kasama sa pamilya na nagkaroon talaga ng anxiety, kamusta po yung mga seniors, no? We will be talking about mental health. All over the world, people have experienced really some forms of mental health problems because of COVID, and we have to talk about it, no? Kasi parang ngayon nag-alert level 1 na, pero marami pa rin paranoid sila, no? Parang may feeling talaga silang inside na kinakabahan, pinapawisan pag lumalabas. So we'll talk about the second pandemic of mental health that came with COVID. And we've got great guests for you. So please join us next week. Pag-uusapan natin yan, yung mga nagkakaroon ng depression, anxiety, nagkakaroon ng post-traumatic stress, tsaka yung mga nag-grieve, no? Yung talagang masama pa rin ang loob nila kasi nawalan sila ng miyembro ng pamilya. So abangan niyo po yan next week. Over to you, Raymond. Ano si Raymond? Oh no, did we lose Raymond? Okay, well, if we lost Raymond, I'll go to his part. Direct, ganun ba? Okay, so this formally brings our webinar to a close. We will, ano ba ito? Okay, so just for your information, all of the Stop COVID Death webinars, Stop COVID Deaths webinars are archived for viewing at TVUP YouTube channel. So if you want to go back, and I think for this particular webinar, you might want to go back and look at this. You can go to TVUP, and then you can find any of the episodes that you may have missed or want to watch again. And we'd like to thank, before we end, all of those who make Stop COVID Deaths possible. So we would like to thank the University of the Philippines, the National Telehealth Center, OVP, PPA, the ITDC, TVUP, UP Manila, PGH, at marami pang iba. Hindi po namin magagawa ito kung wala sila, at nagpapasalamat din kami na nandyan kayo, kasi kung wala kayo, wala rin kami, no? So thank you very, very much. So we look forward to next week, and I don't know if Raymond is back. Is Raymond back?
I'm back, Dr. Susie, but I am having trouble with my camera. So,
sige, ako nang magsasara, Raymond. Okay, so everyone, thank you so much. You can open your camera. O sige, try mo para meron kang ganun. It's a date.
Hindi ko
Ayaw. Sige.
Ayaw.
Okay na, Raymond. Thank you very much, everyone. We'll see you next week. So together we can stop COVID dates. Stay safe, stay connected, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home. but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the